Chair now recognizes Representative Hamadeh for 5 minutes.
Thank you, Chairwoman. As an Army intelligence officer who's served overseas, I understand firsthand the obligation we have to those who wear our uniform. And our veterans deserve more than gratitude, they deserve action. That's why I'm proud to support several of the bills before us today that will directly improve healthcare access and quality of life for veterans all across Arizona and our country. And my first question is for Dr. O'Toole. The alleged budget shortfall within the VA raises serious concerns about your organization's financial planning and resource allocation. Do you believe the VA should undergo an annual forensic audit?
Thank you, Congressman. And first, I just want to say thank you for your service in the military as well as here with us today. So on this particular bill, we do defer to the Comptroller General.
And what is their recommendation?
So by deferring, we are deferring to the Comptroller General on the forensic audit.
But do you believe that having a forensic audit would give confidence to veterans and the taxpayers that their money is being spent wisely?
Yeah, do appreciate the question, Congressman, but we would defer to the Comptroller General.
Dr. O'Toole, the Parker Gordon Fox Suicide Prevention Grant Program has helped expand access to mental health care for veterans. In what ways has the program been most effective, and how can it be further improved to ensure veterans in crisis receive timely mental health care?
Thank you, Congressman. This act has been serving our veterans very well, and we support several of the amendments that are in the bill. The grant program in particular we have found very helpful and has been very supportive. 4 of the amendments in particular we are supportive of, including the extending the duration of the pilot program because of its successes, requiring grantees to inform individuals about their ability to receive emergency suicide care, which we currently do, but I think codifying it is going to be a strength. Ensuring that eligible entities have provided mental health care and support for veterans support services in the U.S. for the previous 2 years, we feel strengthens it. And there's some technical corrections as well we support. The concern we have with this bill is the $500,000 cap and the $10,000 per grantee additional payment, which we think would be difficult logistically to manage in the context of how federal grants are currently managed with providers in that form.
Thank you. And going off of Congressman Bacon's comments earlier, it is a very impressive facility from what I see, and I'd like to visit that, Congressman. And my third question is to Dr. Gold. What were the biggest advantages of using the public-private partnership for the Omaha Center project, and how can this model be replicated across the country?
Well, thank you for asking, sir, and of course, thank you for your service. There are so many different advantages. One was to, of course, save a lot of money. And so what could have cost the VA $136 million ended up costing $56 million out of the VA. Secondly, this project was finished not only exactly on budget, but ahead of schedule, which doesn't always happen in large federal construction projects. At least that's been my multi-decade experience. But it also was able to bring to bear the experience that our university had with being part of this small but very effective 501c3 corporation, in that we had built lots of different healthcare facilities, ambulatory care centers, ambulatory surgery centers, and many other things, women's health centers, imaging centers, etc. So being able to bring all that to bear with the architects, the engineers, and with the construction contractors allowed us to accelerate the planning for the process in partnership with a local VA and deliver it on time and on budget.
Yeah, truly, truly impressive project.
And it is a beautiful facility, an award-winning facility.
On time and under budget. It's pretty rare for the federal government. I yield back.